seasonal habits or the seasonal regimens which one has to follow during particular season. Now, before I start this session, like see, these seasonal changes and adaptations are here just as a base. So now questions will arise, ki this season is not in my country and all. So according to your what the seasons that are prevalent in your country, you can adopt the changes. You can adopt the changes. Understand the concept here. When we go deep into the in different seasons, like in Karna, in India, we are having 6 seasons. In India, we are having 6 seasons. So may not be there in the place where you reside, in the country where you are residing, but accordingly you can make some changes accordingly. If there are only 3 seasons, 2 seasons, or extreme winter, extreme heat, accordingly you can make changes. Just take the concepts of what we have depicted in the Indian seasonal changes as a base, and according to your country, your place of stay and availability, you can make certain changes. Okay. So what is Ritu? Ritu is nothing but a season. Okay. Different features. So in a different season, we experience different changes in the environment. Okay. In summer, there's a different change. In autumn, there's a change. So based on those changes, there is a change in the environment. Because of the change in the environment, we are also seeing a change in the human body. We are also seeing a change in the human body. See, we see various changes in biolife around us, such as flowerings in spring, leaf shedding in autumn, okay, and hibernation of many animals in the winter, and so on. So there is a change in the climate. According to the change in the climate, there is a change in the whole living things, all living things, maybe plants, maybe animals, or maybe humans. Because of the change in the geographical conditions, there is change in the humans, change in the plants, change in the animals. Okay. So as human beings, we are a part of the ecology. We are also influenced by the change in the external environment. So here, in Ritucharya concept, we are going to study how are we going to adopt ourselves to the changes that we are going to experience in different climatic conditions. If we do not adopt ourselves to the change in the climate, then there will be imbalance of doshas within the body. And as we know, dosha vishamata will land up in uh, a diseased state, or will land up in certain health issues. Okay, so what we are going to study here is how one has to adopt themselves, what foods to be taken during those climatic conditions. Before we actually go to Shad Rutus, let me brief you about Shad Rasas. Let me brief you about Shad Rasas. We have 6 rasas, so here we'll be again studying about, there is a little interrelation between the Rutus and Rasas. Okay, so last time all of you clearly mentioned about the 6 rasas: Madura, Amla, Lavana, Katu, Tikta, and Kashaya. There are 6 rasas: Madura, Amla, Lavana, Katu, Tikta, and Kashaya. So accordingly, the English terminologies are given. So here we are having 6 rutus. We are having 6 rutus. In the previous in the first session, we came across the concept of Panchamahabhutas. Can anyone tell me Panchamahabhutas? I'll start with one. I'll say Earth. Among the Panchamahabhutas, one of the Mahabhuta is Earth.
Fire,
Yes.
Earth,
space,
fire,
Earth,
water,
water,
space,
space,
fire, space,
space, water,
air,
air.
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 Good, good. Yeah, you are correct. Yes. So I told you Pancha Mahabhutas for are the basics for the any formation. Any substance on our earth is made up of Pancha Mahabhutas. Like you may be using your PC, you may be using your laptop. That is made up of Prithvi Mahabhuta. That is made up of Prithvi Mahabhuta. Okay. It is, we are all connected in this Teams app. It is through Vayu Mahabhuta. Okay. So like this, everything in this universe is made up of Panchamahabhutas. So here, what I would like to say is in different ritus. These are 6 ritus, 6 seasons. In these seasons, there is change in these Mahabhutas, or these Mahabhutas are predominant. Because of the predominance of these Mahabhutas, rasas are subsequently the rasas are predominant. Because of Vayu and Akasha being predominant, Shishira Rutu, Tikta Rasa is Pradhana. Okay, so this may be a little difficult for you to understand, but just keep this in mind. Again, in future slides, we will see this. So, what I would like to say is, in different seasons, there is different Mahabhutas which are predominant. According to the predominant Mahabhutas, there are different rasas that are being formed. Yes. So we have 6 ritus. That is, we start from here: Shishira, Vasanta, Grishma, Varsha, Sharad, and Hemanta. Shishira and Hemanta, you can take it as winters. Okay. Hemanta early winter, Shishira winter, Vasanta spring, Grishma summer, Varsha rainy, Sharad autumn. Okay. Now again, because of the pollution, because of the pollution, there are, we may not experience exactly the same what we study, or there may be a change wherein during the extreme summer also we may have rains, winter onset may be a little late, etc. Such seasonal changes are there. Okay. Okay, now in India we are dividing, in India we are dividing 1 year, we are dividing 1 year, or we are dividing 1 year into Uttarayana and Dakshina Ayana. Okay, we are dividing 1 year into Uttarayana and Dakshina Ayana. 1 year is 12 months. So these 12 months of the year are divided into 6 months each, 6 months each. Uttarayana and Dakshina Ayana. Ayana is the movement of the sun. Okay, so Uttarayana is the northern movement of the sun. Dakshinayana is the southern movement of the sun. Uttarayana is the northern movement of the sun. Dakshinayana is the southern movement of the sun. Now what comes in Uttarayana? Now what comes in Uttarayana? Uttarayana and Dakshinayana. So 1 year, one calendaric year is divided into two: Uttarayana and Dakshinayana. And we are having 6 ritus, as I mentioned: Shishira, Vasanta, Grishma, Varsha, Sharad, and Hemanta. Shishira, Vasanta, Grishma, Varsha, Sharad, and Hemanta. In these, so Uttarayana has three: Shishira, Vasanta, and Grishma. Varsha, Sharad, and Hemanta are present in Dakshinayana. So here, the bala of the person decreases. Here, the bala of the person increases. Bala of the person increases. Here, when I say bala, bala refers to the strength. Strength of the person gradually decreases. Strength of the person gradually increases. In Shishira, strength is there. In Vasanta, it further decreases. Here in Grishma, it further decreases. Here, strength of the person is good, further increases. In Hemanta, we are having the highest bala, highest strength. So when we talk about bala, it is about the physical strength. It is about the physical strength, physical capacity of the body to do some work, physical capacity of the body to do work. Uttarayana Kala is called as Adana Kala. Dakshinayana Kala is called as Visarga Kala. Okay. In Uttarayana Kala, Agni Guna is Pradhana. Here it is Shita Guna or Saumya Guna is Pradhana. Uttarayana is called as Agnayam cha Agnayam. Okay. In Uttarayana, Agni is predominant. Okay. It's Ruksha Guna Yukta. Here it is Snigdha Guna Yukta. I'll just give you an example for words like Ruksha and Snigdha. But this is just an one basic example for the understanding of Ruksha Guna and Snigdha Guna. How many of us are using body lotions for the dry skin?
Yeah, I am.
Okay. So you're
Yes.
using body lotion. Yes. So you're using body lotion on the skin to moisturize it. To moisturize it. So this moisturizing effect is seen in Dakshinayana, and the drying or the depletion effect is seen in Uttarayana. depletion effect. Okay, so there is loss of unctuousness over the skin. Loss of unctuousness is over the skin is in Uttarayana, and that oleation effect, moisturizing effect is seen in Dakshinayana. Okay, Tikta Kashaya and Katu rasas are pradhana, Amla Lavana and Madura rasas are pradhana. So Madura Amla Lavana are basically nourishing rasas. Tikta Katu Kashaya are basically depleting rasas. Okay, Bala gradually decreases. Here, Bala gradually increases. I repeat once again, when we talk about Bala, it is the strength of the humans, and also to some extent, you can take it as the immunity of the individual also. Immunity also can be considered strength, or simply the strength of a person to do his activities also can be taken. Okay, moving on to first Rutu, Hemanta Rutu. Hemanta Rutu. So, for your better understanding, it's considered as early winter. It's considered as early winter. Okay, so in here in India, we take it as mid-November to mid-January. Yes, there are slight fluctuation in these calendaric dates. Okay, now what happens? Now just keep in mind about early winter. What are the changes? Just that you can keep in mind rather than the months proper. Okay, so there is blow of cold winds and you feel cold. You feel cold. So predominant rasa during this season is Madura Rasa. Predominant Mahabhuta is Prithvi and Aap. Prithvi and Aap. So among the Pancha Mahabhutas here, Prithvi is the earth, Aap is the water. So earth and water are predominant. Okay. Yes, because of the cold wind. Cold wind is nothing but Aap. And this coldness is Prithvi Guna Pradhana. So Prithvi is earth, Aap is Jala or water. So here Madura Rasa is predominant. The strength of a person remains on highest grade and vitiated pitta dosha gets pacified. So here, always in Hemanta Rutu or in the early winter, it is one of the best climatic condition for the strength of the humans, for the strength of the humans. Uh, for all the I in the previous in the first session we spoke about Garbha Samskara. In the first session we spoke about Garbha Samskara for patients who come to us for pre-pregnancy counseling and all. We pre-pregnancy counseling we ask them to plan for intercourse and plan for a child or plan for conception rather during the months of Hemanta Rutu. During the months of Hemanta Rutu, why? The strength of the individual is good, and we also believe that the fusion of the male and female gamete, so the climatic conditions, the what you call the psychological condition of the couple at the time of intercourse or at the time of conception has a very important role on the child that is born. So if they want a child, if they want to beget a child who is having good strength, then preferred duration or the climatic condition for conception would be Hemanta Rutu. Hemanta Rutu. The only reason being the strength of the individual is good. Okay. Activity of Agni is also increased here. Activity of Agni is also increased here. Now, we know that Agni of a person is good. Agni, we refer to digestive capacity. So I'll just, before we go to the next slide, I'll just give you an example. We have three people. I'll explain a little, I'll give you a hint into Agni. We have three sets of people. One person is having five chapatis. Might not be five. Okay, an individual is having four chapatis and one bowl of rice. We have another individual who is having um, three chapatis and one bowl of rice. We have another person who is eating one chapati and half bowl of rice. So a person who is eating the maximum, he is having Tivra Agni or Trikshna Agni. That means his digestive capacity is more. Person with three chapatis, moderate. Person with one chapati, less. So when we are having a person who is having Tikshna Agni, so we have three types of Agni: Tikshna Agni, Mandagni, and Madhyama Agni. So Tikshna Agni, Madhyama Agni, and Mandagni. So here in Hemanta Rutu, Agni is very much increased. Digestive capacity is very much increased. So when you have good digestive capacity, what is the amount of quantity of food one is supposed to take? So a question, when you are having good digestive capacity, should you take good amount of food or should you reduce the quantity of food?
Increase the quantity.
Increase the quantity. So here, when I spoke about three Agnis, Tikshna Agni, Mandya Agni and Madhyama Agni. So in Hemanta Rutu, Agni of an individual is really good. Agni of an individual is good. Hence, the foods that we are recommending in Hemanta Rutu is milk, butter, ghee, jaggery. Tila is called as sesame. Tila is called as sesame seeds, black gram, and freshly harvested rice. Freshly harvested or newly harvested rice. Any questions you want to ask here can be asked. See, in India, we
Understood.
recommend to understood. Okay, good. So in India, we recommend to eat rice which is old, at least 3 months old, 6 months old. But here in this condition, we are asking people to eat freshly harvested rice. Why?
The water content of freshly harvested rice is more and maybe more difficult to digest. I don't know. It's just a thought.
Yeah, okay. Can somebody add on to this? She has partly answered it.
Mhm.
Is it more starchy?
Is it more?
Starchy.
Exactly. Yes. Starch is heavy to digest. And your friend also told that. Yes. It is more having more of starch. Yes. And for the digestion of starch, you need really good Agni. And hence, since in Hemanta Rutu, you are having good amount of Agni, you can use this kind of freshly harvested rice. The same holds good for all the others also. Milk, butter, ghee, jaggery, tila, and black gram. All these are or rather may not be tila or yeah, jaggery, but rest black gram, ghee, butter, and milk. So here we need, or they are all Prithvi and Mahabhuta Pradhana, and they are taking longer time to digest. So they need Tikshna Agni, and Tikshna Agni is already prevalent. When you're having Tikshna Agni, consuming all this, any questions here? Okay, moving on to the next slide. Yes, since we have good Agni, that those are the kind of ahara which one is supposed to take. Which one is supposed to take. Next, moving on to Vihara. So, what are the activities? And in this, so Agni is good. Okay, your strength is good. Since you are having good strength, go for good workout. Go for good workout. Where the climatic condition is cold, wear woolen clothes. Go for Abhyanga, maybe Shiro Abhyanga, Sarvanga Abhyanga, and even Shirodhara. Shirodhara. What happens in cold climate is your skin tends to peel off, your skin tends to become dry. Hence, take care of your skin with respect, with head massage, with Sarvanga Abhyanga, that's the full body massage, and Shirodhara. Shirodhara. Any questions? This completes Hemanta Rutu. And here you can do workout to half of your capacity, to half of your capacity. When we studied about in Dinachara, we studied about Vyayama. He says Ardha Shakti Nishevyastu. So Snigdha Bihi, Bali Bihi, Bhoji Bihi. So person who is having good strength. Here in Hemanta Rutu, due to climatic conditions, humans are having good strength. So they can do a good work as to half of their capacity, half of their capacity. Okay. And I have one more question here. Yeah, that's actually related to the question from Vyayama concept only. Okay. So, what do you personally feel? Should you go for gymming or should you go for yogasana and simple loosening cardiac exercises?
Intensive workout, maybe gymming in
See,
winters.
Okay, so you're telling with respect to the season, yes. In winters, you can go for go for activities in the gym. That's okay. But even if you go for activities in the gym, no, yeah, that's correct. For Hemant Rutu, going to gym is acceptable. But in general, when you are having an option for using a gym and also option for yogasana and simple workouts, go for yogasana and simple workouts. Why? Because you are not going to strain yourself much. You're not going to overstrain your body. You're not going to
Yes.
overstrain your muscle. Overstraining will again land up in certain complications which we may not be aware that it is due to these exercises. In recently in Karnataka, we have one of our famous actors, Puneet Rajkumar, expired. So post his death, it was that he was a person with six packs, etc. But the cause of his death, or he died due to myocardial infarction, the reason being excessive workouts at the gym. Reason being excessive workouts at the gym. So do not go for excessive. So that's why Acharya Charaka tells Ardha Shaktiya Nishevastu, don't overdo, don't overstrain yourself. Okay.
Mm.
Yes.
But
What is to
is
be
jogging will jogging be considered intense?
jogging? See, anything will not be considered as intense. It depends on the quantity, how much you're doing, and how your body is responding to that. See, a person is going to jog for 5 kilometers, he may not be stressed. But the other person who is doing it for 5 kilometers, he may be stressed. See, we cannot
Yes.
quantify these. We cannot quantify this. It is up to you how your body responds. By jogging up to 2 kilometers, if you're feeling exhausted, kindly stop it there.
Hmm.
Okay, so it is how
Okay.
your body responds. So I told you one thing wherein you are going to check your the sweating on the forehead. But sometimes obese people sweat very immediately. Even they jog up to half a kilometer to 1 kilometer, they start sweating. That is because they are having adipose tissue much in the body and hence they sweat. But for the others, how much your body can do, you should be comfortable at the end of the exercises or jogging, whatever you do. If you feel you're
True.
not comfortable, if you feel you're overdoing it, then that's the time you need to reduce the amount you have done.
Thank you. Yeah.
So here, since Agni is good, we need to take foods which are kapha predominant and not vata aggravating foods. Vata aggravating foods such as laghu, shita, and dry. Okay, you should not take foods which are light, which are cold, and which are dry. Intake of cold drinks is contraindicated. Exposure to strong and cold wind, habit of day sleep, etc., are to be avoided. Here, see, in Ayurveda, we give much importance to sleeping during the day. We give much importance to sleeping during the day. Do not sleep during the day. That increases the kapha in the body. That increases the kapha in the body. Okay, if you are healthy, do not sleep during the day. Okay, only in Grishma Rutu or in summer season, sleeping during the day is advisable. Sleeping during the day is advisable. Rest other Rutus, it's not advisable. Again, we have exceptions. People who are suffering from ailments, suffering who are deceased in pregnancy and during the childhood. Those conditions, they can sleep in all seasons during the day. That is because they need to conserve energy. But in case of healthy people, do not make it a habit to day sleep, especially people being obese, people suffering from thyroid, people suffering from diabetes mellitus type 2. Do not have a habit of sleeping during the day. If diabetes mellitus type 2 being lean diabetics, then you can sleep during the day. Else, sleeping during the daytime is contraindicated. Okay. Shishira Rutu, it is mid January to mid March. So here, Shishira Rutu is nothing but an intense form of Hemanta Rutu. Intense form of Hemanta Rutu. Environment remains cold along with cold wind. So here the predominant rasa and Mahabhuta are Tikta rasa and Akasha Mahabhuta. The strength of the person becomes less, deposition of the kapha dosha occurs, and Agni remains in a higher state. Okay. So since we know Shishira Ritu, the climate is going to be much more colder. So massage with oil, powder, paste, etc. is advisable. Bathing with lukewarm water or hot water. Exposure to sunlight, wearing warm clothes. Exposure to sunlight, if at all it is there. Else going into fireplace and exposing oneself is also advisable. So the reason is, understand here that it is cold winter. Do not take cold foods. Do not expose yourself to cold. People who are in extremes of cold climate, you might notice that you are having uh, frostbite, trench throat, etc. Okay, foods having Katu, Tikta, Kachaya rasas are to be avoided. Laghu and Shita foods are to be avoided because if you take Laghu and Shita, light is easy to digest. If you take easy to digest and Shita foods, then what will happen? You are going to, if you're taking Shita foods, you are going to further hamper your Agni, and Laghu Ahara will not kindle the digestive fire, will not kindle the digestive fire. And vata aggravating lifestyle like exposure to cold wind should not be done. Exposure to cold wind should not be done. Reason being, since you are exposing yourself to cold wind, there may be chances of paralysis, there may be chances of frostbite, trench foot in cases of extreme climates. Extreme climate. Sleeping at late night is not advisable. Why? It will cause again vata prakopa in the body. It will cause again vata prakopa in the body. So, or it will cause an imbalance in vata dosha, hence it's avoided. Any questions here for Shishira Ritu? Shishira Ritu is nothing but an intense form of Hemanta Ritu. So the do's and don'ts, everything apply the same for both. Look, moving on to Vasanta Ritu. So the approximate time is from mid-March to mid-May. Here in India, we have the fruiting season here. The season is considered a season of flowering and origin of new leaves. Predominant rasa is Kashaya rasa, and Mahabhutas are Prithvi and Vayu Mahabhuta. Strength of the person remain in moderate degree, and Kapha dosha here Kapha dosha is aggravated. Kapha dosha is aggravated. That means Kapha dosha is ready to get eliminated from the body. Agni is manda. Agni is manda. Okay. So here, what you understand here is, as the strength of the sun increases, the kapha which is aggravated in Hemanta Ritu starts melting and obstructs the Jataragni and causes many diseases. I will explain this. And Rukshatara increases Madhyama Bala. Here in Vasanta Ritu, kapha is aggravated in the body. It is aggravated so much that it can be easily eliminated out of the. It can be easily eliminated out of the body. So since it is going to be eliminated out of the body, here we can do procedures like Vamana, Panchakarma Vamana. Okay, so when we can somebody tell me which are the Panchakarmas?
Air, water,
Uh,
space,
Nasya,
earth.
Yeah, it's air, water are Pancha Mahabhutas. We have Panchakarmas are 5 activities. Yes, somebody was saying
Vamana,
Nasya.
Virechana, Nasya, Vasti, and Rakta Mokshana.
Tamokshana.
Good. Is this Mala Singh?
Yes, Doc.
Yeah, good. So, yes. So, your friend told Vamana, Virechana, Nasya, Basti, and Raktamokshana. Yes. In this, we are doing Vamana. In this, we are doing Vamana. Because Kapha dosha is accumulated in Hemanta Ritu. Just because now that accumulated Kapha is having a change in that accumulation, it is ready to expel in Vasanta Ritu. So, we are giving Vamana as a treatment here to expel the affected kapha dosha or to expel the accumulated kapha dosha. So, so there was a question in previous sessions asked like, in healthy people, can we do panchakarma? Yes. In Vasanta Rutu, mid-March to May, we are doing Vasantika Vamana, wherein we are giving it for the healthy also. We are giving it for the healthy also. Yes, for disease, we are doing it for the disease purpose, for the healthy to maintain the health. So even in healthy and also unhealthy people, there is kapha accumulation. So we try to evacuate the kapha that is being expelled out. So here it is Vamana that's being done. Vamana. Yes. Nasya. Nasya is the treatment for the Jatru Urva, that is supraclavicular region, the region above the neck, the region above the neck. So to eliminate the kapha dosha from the head and neck, we are going to do Nasya as a treatment. We are going to do Nasya as a treatment. Yes. So here Anjana, I told you, Anjana is done to the eyes to eliminate the kapha out of the eye, to eliminate the kapha out of the eye. Yes. Now, what is this treatment? Any guesses? I mean,
Dry powder massage.
very good, very good.
Abhyanga.
Who said that? Dry powder massage.
Hanurita.
Okay, Ahanita, it's correct. It's a dry powder massage. So for dry powder massage, we don't call it as Abhyanga, we call it as Udvartana. We call it as
Upavartana.
right.
Okay.
Perfect. So in the previous class section, studied that Udvartana is a dry powder massage done to eliminate the kapha dosha out of the body. We are doing Udvartana or a dry powder massage to eliminate the kapha dosha out of the body. So here, the treatments what we are seeing, all four are done to eliminate the vitiated kapha dosha out of the body. Okay. So here, when you're studying the RITUCHARYA, what you need to understand, it is nothing but the doshic treatment. It is nothing but the treatment of the doshas. Okay. Because see here in Vasanta Ritu, kapha dosha has to be removed out. So you need to do treatments which will remove the kapha dosha out of the body. Vamana is a treatment, Nasya is a treatment, Udvartana is a treatment, Anjana is a treatment. All these treatments aim at eliminating the kapha dosha out of the body. Okay. So here another, here, yes, Vihara. So among that, one more is to do exercises. So by exercising, you're going to reduce the kapha dosha within the body. By exercising, you're going to reduce the kapha dosha within the body. Any questions?
Is Anjana the same as Netra Tarpan? No, that's different.
Netra Tarpana is basic. Anjana is just applying. Anjana, it is just
Ah,
like, how to apply kajal. It's just like application
okay.
of kajal. Netra Tarpana
Okay.
is, Netra Tarpana, a frame
Ghee,
is,
medicated ghee.
yeah, pouring of medicated ghee to the eye and eyes are blinking. Okay, that is Netra
Ghee.
Tarpana.
Okay. Okay.
Okay, in Vasanta Ritu, Netra Tarpana is contraindicated.
Okay.
In Vasanta
Okay.
Ritu, Netra Tarpana is contraindicated. Okay, but yes, if you have a patient and in them,
Yes,
if you
doctor.
feel kapha is depleted in the eye, only then you can do Netra Tarpana there, or else you should not do.
Okay. Thank you.
Okay.
Doctor, just a clarification. The dry massage, we should not do it if patients are suffering from lower back pain.
Yes, low back pain, cardiac issues, recent MI, recent operations for stent and all, angioplasty. Recent angioplasty, dry powder massage is not advisable.
Okay.
I will repeat,
Okay.
low back pain, recent history of MI, recent angioplasty, okay, or any such cardiac issues, it should not be done. Vamana also is contraindicated in recent MI, recent cardiac issues. Abnormal ECG, Vamana is not advisable.
Okay.
Ahara and Vihara to be avoided. Foods which are hard to digest are to be avoided. Shita, Snigdha, Guru, Amla, Madura are not avoided. Shita, cold, Snigdha, viscous or unctus. So Shita and Snigdha, you understand the concept as to why. So you can adopt it according to, may not be changes in the Ritu, but simply observing the changes within the body also you can adopt these concepts. Shita and Snigdha, that is cold and unctus foods. Cold, unctus, and heavy to digest foods are not advised in this season. Why? Because already there is kapha dosha accumulated. You take cold, you take unctus, you take heavy foods. Again, the food becomes, or again it will further accumulate the kapha dosha within the body. Here in this season, we are not giving the freshly harvested rice. We are giving the old rice. Why? Because already kapha is accumulated in the body. You take freshly harvested rice, again it will further accumulate kapha dosha in the body. Here we have to give old rice, preferably the old rice. Amla and Madura rasa are also not advised. Amla and Madura rasa, why? Again they will accumulate the kapha within the body. Okay, so when we say these are not advisable, that means they are going to increase the kapha dosha within the body. See again, he says newly harvested grains, curd, cold drinks are also to be prohibited. Day sleep is strictly contraindicated. Why? Because we are in a position to eliminate the kapha dosha out of the body. If you sleep during the day, again you're going to increase the accumulation of kapha within the body. Hence, not advisable. Okay, was there any questions? So you can take this as simply treatment for kapha dosha. Vasanta Rutu's do's and don'ts or ahara and vihara can be taken as treatment for kapha dosha within the body. One thing I missed. Vasanta Rutu ahara. Vasanta Rutu ahara. He says old barley, old wheat, honey. Honey has a scraping action. Honey has scraping action. Hence, or it will help in removing the kapha dosha out of the body. Hence, honey is indicated in Vasanta Rutu. Old barley, old wheat, by Purana foods, Purana grains, or old rice. They are going to have less starch, less carbohydrates. Hence, they can be given in this particular Rutu. Clear?
Yes.
When we have ghee and honey as an option, okay, ghee is more nourishing, honey is more depleting. Ghee is more nourishing, honey is more depleting. Okay, now you have two people. One is said to be well built. When okay, you have one person who is obese, one person who is lean. Okay, you have two patients or you have two participants. One is obese, one is lean built. Now you need to choose whether to give honey or ghee. To which person will you give honey? To which person will you give ghee? So the properties of the both I'm telling in one line. Honey is going to be depleting in nature. Ghee is going to be nourishing in nature. So what will you choose for obese? What will you choose for lean built?
Honey for the obese and ghee for the lean.
Yes.
Okay. Okay. Does anyone else have any other opinions?
Uh, Sometimes an obese person can also be very unhealthy, so ghee can also nourish them.
Yeah,
But
can be given. Yeah, yeah,
yes,
that's correct.
yes.
Can barley be sprouted?
Can barley be sprouted? I haven't tried that. I feel it cannot be sprouted. I don't know. If anybody here in the meeting has an input can share, but I personally feel it cannot be sprouted. I don't know. I haven't tried.
Okay, thank you.
Yes, so one of your friends answered. Honey is given for the obese, and for the lean milk is ghee that should be given. So the rationality for me to ask this question is you should understand where to use honey, where to use ghee. The same. Now the obese person can be compared to kapha. The lean person can be compared to vata. In vata, you are going to give ghee. In kapha, you are going to give honey. You are going to give honey. So wherever you feel it is kapha dosha that's aggravated, give honey. Wherever you feel vata dosha is aggravated, give ghee. Simple. I will apply this to cough. I will apply this concept to cough. You have a dry cough and you have a productive cough. Dry cough is you are simply coughing. Productive cough is wherein you cough and the sputum, the kapha comes out of the body. The sputum comes out, the phlegm comes out of the body. When you're having phlegm coming out, that is kaphaja dosha or kaphaja kasa. You choose honey. When you're having a dry cough, simply keep on coughing and it's irritating and at the end you have pain. In that condition, give ghee. It will improve. Yeah.
I just want to find out if anyone else having a problem with your voice bouncing.
Okay. So only the last concept wasn't audible.
Sound on my side is fine.
Okay.
Actually, the speakers are fine, but only you, doctor, and you speaking, it seemed like it's bouncing on my side. So it could be a problem on my laptop.
Okay, done. So in a nutshell, Vasanta Rutu Ahara and Vihara can be considered for the treatment of Kapha dosha. Okay. Moving on to another Rutu, fourth Rutu, Grishma. Mid-May to mid-July is considered as Grishma Rutu. Summer. Environment is prevalent with intense heat and unhealthy wind. River bodies are dried and the plants appear lifeless. Predominant rasa is katu, pungent. Mahabhutas are Agni and Vata. The strength of the person becomes less. Yes, in Grishma Ritu, we do not have good strength. Deposition of Vata dosha occurs, but the vitiated Kapha dosha is pacified during this season. Agni of the person will remain in mild state. The strength of a person is reduced. Strength of the person is reduced. Okay. Yes. Okay. So in Grishma Ritu, what would do all of us, or you assume yourself you are in the summer season? What is that? Would you like to choose to eat or drink?
To drink.
Yeah, to drink. Yes. Why? Because we
Yes,
are
they have
having
more
Agni,
liquids.
we are having mild Agni, and we are also having depletion of water from the body in the form of sweat. So hence your body demands for liquids so that it can replenish the water levels within the body. Yes. So here we are giving fruits like watermelon, raisins, tender coconut, water from earthenwares, buffalo milk or cow's milk. Milk is advised. Okay. So just understand here, since Agni is reduced, and also because of the climatic condition, there is depletion of water from the body. It is depletion of water from the body. Hence, you need to replenish your body. Hence, you need to replenish your body with liquids. Hence, you need to replenish your body with liquids, and also liquids which are easy to digest, because Agni of the person is reduced. Agni of the person, or the digestive capacity of an individual is reduced. I told you, Mrudu, Madhyama, and Tikshna Agni. Here the Agni comes to Mrudu state. Agni is in the state of Mrudu. That go back to the example of 4 chapati, 3 chapati, and 2 chapati. Your Agni is reduced to such a level wherein you can digest only 2 chapatis. Okay, so what is the Viharavan supposed to do? Spend time in gardens or wherever there's canopies or wherever there is greenery, just masking yourself from the sun, swimming, etc., water activities, paste of sandalwood, and wearing pearls, fanning yourself, etc. So you will tell me, madam, why all this we are using ACs in summer? Okay, the lifestyle modification as per your need and convenience you have adopted. Okay, ahara and vihara to be avoided, lavana and katu. Okay, lavana, katu, amla, ushna foods are to be avoided. Ushna, climate itself is hot. Like you would not like to eat something hot in summers, you would like to choose something which is cold. And also lavana, katu, and amla, they will further increase vata dosha in the body, hence they're not advisable. Excessive exercise or hard work is to be avoided. Alcoholic preparations are prohibited. And during this season, sleeping during the day is very much advisable. Sleeping during the day is advisable in case of Grishma Ritu, the only Ritu or the only season where Acharyas, Charaka, Sushruta, Vagpata recommend sleeping during the day. Why? Because we need to save our energy. Our bala is very less. Strength of an individual is very less. Just to restore the strength within the body, we need to have sleep. We need to have good sleep. Yes. Varsha Rutu. Varsha Rutu, mid-July to mid-September, is considered as Varsha Rutu. During this season, the sky is covered by clouds and rains. River bodies, etc., are filled with water, and the predominant rasa is Amla rasa, and Mahabhutas are Prithvi and Agni. The strength of the person again becomes less. Vitiation of Vata dosha and deposition of Pitta dosha. Agni also gets vitiated. Kshina, Agni, and Bala. Here, the strength of the person is reduced. Sharirika Bala is reduced. Agni is reduced. There is vitiation of Vata dosha. Vitiation of Vata dosha. Vata dosha is ready to be expelled out of the body. Okay. So here, Varsha Rutu, that's the rainy season. Though it's rainy, since it's rainy season, there is, because the water flows from one place to another place, it is contaminated. It's contaminated. So better boil the water and drink. Better purify the water and drink. Here it is Mudga Yusha. Mudga Yusha is green gram. Mm, green gram. See, green gram is one of the dicotyledons. Green gram is one of the dicotyledons. Dicotyledons, among dicotyledons, green gram is the one which is easy to digest. Green gram is the one which is easy to digest. So we are making a soup out of it. Where see, when you are having people from India can answer this. I think if you can understand this in a better way. If you see, when I told green gram is easy to digest among the dicotyledons. Dicotyledons are among the pulses. We recommend green gram because it's easily to digest. In Varsha Rutu or in rainy season, we are advising green gram soup. We are not advising green gram sweet. Green gram sweet. Why? Can anybody from India answer this? Yeah, if Mala Singh and Reji, if you are having an answer, you can.
Because sweets will have sugar and that will increase the acidity in the body.
Okay, yeah, sweets will have sugar. We having sugar, it's not acidity. Having sugar, again, they become heavy to digest. Here we need to understand Agni is less. You need to see whenever we go to restaurants or if we are having soups, if we are starting our meals with soup, why? We are starting our meals with soups to kindle our digestive fire, to increase our appetite. Here we are giving dicotyledon soups or we are giving dicotyledons in the form or blending it with spice and we are giving. Why? Because we need to increase the digestive capacity. We need to increase the Agni. If we give the same dicotyledon or the same cereals, same pulses with sweet, then we are further or we need to further take care of the digestive capacity.
Digest.
So
Okay.
dicotyledon soups. Okay, hot water. Since it's Varsha Rutu, I told you Vata dosha is predominant. For Vata dosha, the best treatment is, guess this, name this Panchakarma, which is this. I told you it cleanses the lower GI.
Enema. Enema.
Yeah, very good. It's enema. So we are giving this enema, we are giving this Basti treatment to eliminate the Vata dosha out of the body, to eliminate the Vata dosha out of the body. So learning from this slide is Varsha Rutu Ahara Vihara can be taken as treatment modalities to treat Vata dosha within the body. To treat Vata dosha within the body. Yes, since it's Varsha Rutu, I have just put in contents from Ashtanga Hridaya. You may feel it a little, what do you call, less, you may feel it a little childish, but yes. So the clothes need to be pressed. The reason being that Varsha Rutu, clothes don't dry soon. So don't wear wet clothes and, bring in fungal infections, etc. to the body. Okay. Ahara and Vihara to be avoided. Intake of river water, etc. Foods which are heavy and hard to digest. So I hear that same concept, heavy and hard to digest. Mudga or the green gram sweets are not advisable. Rather, green gram soups are advisable. Again, when we have green gram and black gram, people from India, uh, green gram and black gram, we have options. Green gram soup and a black gram soup. Black gram soup we cannot do actually. Okay, we have green gram soup and a black gram soup. As per classic and in practical.
Mom, can you repeat it, please? I couldn't hear
Yeah,
it.
I will.
Doctor, we can't hear you.
There is disturbance. Hmm. Okay, so we have an option here.
It's echoing. Difficult to hear.
Yeah, I understand.
Yeah. Maybe everybody has to mute first.
Yeah, I did mute one of them was not muted. I muted. Okay, yes. Now
Yes, ma'am. Can you please repeat, ma'am?
we have an option for green gram and black gram. Okay, green gram sweet and a black gram sweet. We need to understand that though both being dicotyledons or though both being pulses, but green gram is the one heavy to digest, black gram is the one, green gram is light to digest, black gram is the one heavy to digest. Black gram is the one heavy to digest. So when we have an option for these two, in Varsha Rutu, you can choose. In rainy season, you can choose green gram. But if you have an option for a green gram sweet and a black gram sweet, go for a green gram sweet. Comparatively, green gram sweet is easy to digest than compared to a black gram sweet. That's how you need to modify your diet uh, in the kitchen as per the doshas and the climatic conditions. Okay, so though green gram and black gram both belong to the variety of dicotyledons, green gram is the best. Why? Because it is easy to digest. Black gram we do not consider the best because it is heavy to digest. But the same thing, black gram is advisable in case of Shishira Rutu. Black gram is advisable in cases of extreme winters. Black gram is advisable in extreme winters. Why? See, I am advising green gram to be taken during Varsha Rutu or during rainy season. But I am advising green gram should be taken during the winter season. Why?
Because it increases the digestive fire, the Agni in the body.
Uh, no.
Sure. Okay.
Okay. So we are advising black gram in extreme winters. Why? Because our already Agni digestive capacity is very high. Since it is high, it will be able to digest the black gram. Okay, it will be able to digest the black gram.
Okay.
Okay. Next, moving on to the last Rutu, Sharad Rutu. So Sharad Rutu is between September to November. During this time, sun becomes bright. The sky remains clear and sometimes with cloud and earth covered with wet mud. Okay. Up and Agni are Mahabhutas, Lavana Rasa is predominant. Strength of the person remains medium. Pacification of vitiated Vata Dosha. Vata Dosha was aggravated in Varsha Rutu. That is pacified in Sharad Rutu. And there is vitiation of Pitta Dosha. There is vitiation of Pitta Dosha. And Agni increases during the Agni is little better in Pitta Dosha. Now, Sharad Rutu is Pitta predominant. Agni is slightly increased. You are giving green gram. You are giving honey. You are giving Pancha Tikta Grita. This is a medicine. This is a medicine. Pancha Tikta Grita. So here we were talking about ghee consumption, etc. When we come to usage of ghee, ghee is better advised for Pitta Dosha. Ghee is better advised for Pitta Dosha. Barley and wheat are advisable. This is Indian gooseberry for the people who are not from India. This is Indian gooseberry. Indian gooseberry is advisable in this Sharad Rutu. Okay. Panchatikta Grita is a medicine. Panchatikta Grita is a medicine. It is a medicine which is processed with Tikta Rasa Dravyas. It is medicine which is processed with Tikta Rasa Dravyas. Tikta Rasa Dravyas, they pacify, Tikta Rasa Dravyas, they pacify Pitta Dosha. Tikta Rasa Dravyas, they pacify Pitta Dosha. Hence, we are using Pancha Tikta Grita. Pancha is 5, Tikta is 5. 5 bitter drugs are used in the processing of ghee. 5 5 Tikta Rasa Dravyas are advised here. Okay. Now, in Sharad Rutu, what we are doing? In Sharad Rutu, we are advising application of sandalwood paste, application of pearls, and also using or exposing oneself to moonlight. Exposing oneself to moonlight. Exposing oneself to moonlight. In Ayurveda, we are having few preparations which we are doing on exposure to moonlight. So here the reason of exposure to moonlight is that it's going to imbibe the cooling properties of the moon. It's going to imbibe the cooling properties of the moon. Okay, like medicines like Pravala Pishti. Medicines like Pravala Pishti we are using. Why? Because they are having cooling nature. They are having cooling nature, and it is processed under the moonlight. Under the moonlight. That means we are going to sit outside and exposed to the night sky and prepare the medicine. Reason being, we need to imbibe the cool nature of like the moon. What are the treatments that we are doing in Sharad Rutu? So can you guess some treatments seeing these images?
Basti.
Basti we came across as a treatment for Varsha Rutu.
Leech therapy for varicose veins.
Leech therapy, right? The above one is venesection. Both come under Rakta Mokshana. Both come under Rakta Mokshana. I told you one Panchakarma. See, where there is emesis or where there is vomiting, that's vomit. There is one treatment wherein there is loose stools. So which is that treatment?
Virachan.
Yeah, so here, see, Virechana is the treatment done for Pitta dosha. So as I said, here there is Pitta dosha that's been aggravated. Pitta dosha is aggravated. So to eliminate the Pitta dosha, we need to do Virechana. In Sharad Rutu or Sharad RITUCHARYA can be adopted as a treatment for Pitta dosha. Leech therapy can be done, venesection can be done, Virechana can be done. So inducing loose stools, doing venesection, doing leech therapy, Rakta Mokshana, Jalavakavacharana, and Virechana are the treatments one can adopt during the Sharad Ritu. Okay, now that completes all the 6 Ritus. So basically, I would again say that to understand the changes, accordingly adopt what you can follow during those regimens. Yes. Now, Ritu Sandhi. Ritu Sandhi is the 7 days. So we have 2 Ritus, assuming we have Grishma and Varsha Ritu. Okay, Grishma is the rainy season. Sorry, Grishma is the summer. Varsha is the rainy season. You take the last 7 days or the last 1 week of Grishma Ritu and the next 7 week of the this thing. Last 7 days of Grishma Ritu and the next 7 days of Varsha Ritu. So you get a days of 14 days, or you get a period of 2 weeks. That period, what you're supposed to do is taper the habits of the Grishma Ritu and adopt the habits of Varsha Ritu. So you're going to taper the activities or the lifestyle or the food habits of the previous Ritu, and you're going to adopt the habit and lifestyle of the next Ritu, of the succeeding Ritu. So that is called as Ritu Sandhi. By doing this, we are not immediately switching over our lifestyle from one to other. We are gradually tapering our lifestyle from one kind of lifestyle to another. So that is Ritu Sandhi.
Doc?
Yes, am I audible now?
Yes. Can you just explain that again to me about the last part that you spoke about?
Yeah, I will.
Okay.
In Hemanta Rutu, sleep is not recommended. Only in Grishma Rutu, sleep is recommended. Okay. Shishira Rutu, and in Hemanta Rutu, since your Agni is at its best, eat well and at your will. Shishira Rutu follow Hemanta Rutu regimen. Shishira and Hemanta almost same. Vasanta Rutu, it is Kapha dosha which is aggravated in the body, Kapha dosha which is increased in the body. So treatments like Vabana to be done, Udvartana to be done, Anjana to be done, Nasya to be done. Okay. Next, Grishma Rutu, since the strength of the person is less, Vata dosha is aggravated, you can sleep during the day and you should use plenty of fluids or liquid diet. Varsha Rutu, contaminated water. So take care of the water you drink. It is in this season. People are prone to upper respiratory tract infections, viral fevers, dengue, etc. So take care of waters. Water should not be accumulated in and around your house to prevent diseases, vector-borne diseases. Drink boiled water. Treatment of choice is Basti. Treatment of choice is Vata Shamana. Sharad Ritu, since Sharad Ritu, Pitta is more, you have to go for Pitta Shamaka or Pitta pacifying conditions. Okay, any questions? No questions?
Normally, people have the habit of sleeping after a lunch. That means you should avoid sleeping after lunch for 15-20 minutes.
See, if you're sleeping for 15-20 minutes and if it has become your habit, you can continue. You can
Okay.
continue. Okay. But if you're sleeping for long hours during the day, like especially
Okay.
it happens with how they sleep for 2 to 3 hours just because they don't have any work to do, that is
Okay.
not advisable.
Okay. Thank you. How sleeping during the day affect the diabetes?
See, sleeping during the day, how it will affect diabetes. I will tell you, sleeping during the day, we are going to increase the kapha dosha in the body. Diabetes mellitus is also a disease caused due to kapha dosha in the body. So it will aggravate the kapha dosha, in turn aggravating the diabetes mellitus. Again, when we talk about diabetes mellitus, we classify them into two: diabetes mellitus who are lean built and who are obese built. So this applies to people who are obese built and diabetic, who are obese built and diabetic. You will see diabetic people who sometimes have initially, when they are diagnosed with a case of DM2, they have lost weight suddenly, 10, 15 kgs, suddenly they have lost weight. But you also see some people who are having diabetes, and after 10, 15 years, after 10, 15 years of being diagnosed with diabetes, they tend to lose weight after 10, 15 years. That means Kafaja Prameha or Kafaja diabetes is becoming Vataja diabetes. So there is a change in the doshas that are being affected. So accordingly, you should plan.
Is diabetes reversible?
See, diabetes is not reversible. If you want to reverse it, you have to make a lifestyle change. See, diabetes mellitus is a lifestyle disorder. You bring back the normalcy in your lifestyle, you will be free from diabetes. It is affecting people with all the luxurious lifestyle.
If the
That's
sugar
it.
no for diabetes, we cannot take sugar at all in case of diabetes.
See, it is not like you cannot take. If you are doing good workout, you can take. If your physical activities are good, you can take.
Thank you.
Okay.
Normally, I've noticed that people who suffer with diabetes, they receive an injection to avoid this. Can you advise, please?
What do you want me to advise? See, people who are on diabetes mellitus, they are taking insulin injections.
Yes.
So what should I advise them?
Is it a good thing to do, or rather take some like Ayurvedic
Tablet.
medicines for it? Yeah.
If a person is already on insulin, that means his blood sugar levels are not under control. His blood sugar levels are not under control. Hence, after giving tablets, if his blood sugar levels are not coming under control, then only they are putting patients on insulin.
Hmm.
It is not, we cannot treat people on insulin dependent diabetes. But the thing is, yes, we need to have a close monitoring of the patient, and yes, we can withdraw them from insulin. Again, close monitoring of the patient is required.
Thank you.
Doctor, can I ask a question?
Yes, please.
I know in your last session you spoke about gold, using gold as medicine.
Mm-hmm.
Can you give us a bit more explanation on that?
Okay, see, when we are using gold as a medicine, we consider gold to be a heavy metal. Okay, so we have Swarna, Rajata, Tamra, Loha, Naga, Vanga, etc. So that's gold, silver, iron, uh, tin, lead, etc. come under heavy metals. Okay, so when we are using gold as a medicine, we are going to purify that. We have certain methods of treating that particular gold. It may be in the form of purification, in the form of dipping it in some kashayas, or subjecting it to putties. Putty is nothing but incineration technique. It's an incineration technique. Not everybody can do that. People who are specified in the branch of Rasa Shastra, people who are specified in a branch of Rasa Shastra, that is, people who are specified to who learn the pharmaceutical medical preparations, only those branches do it. They use incineration technique. And then once it is incinerated and it is subjected to uh, the quality check, it is subjected to quality check, only then that particular medicine is released into the market. It has various purification and treatment measures. That particular gold itself is being purified and treated with certain medicines, and only then it becomes ready to use for the human body.
Okay, and what do we use it for? What type of ailments do we use this the gold for?
See, sometimes when we are having cases of rheumatoid arthritis, which is very severe, not coming into control. So in that condition, we are going to give gold preparations. Gold preparations, like that same medicine, to that same medicine, gold is being added. Okay, then that we get little faster results. And also for soothsayer, we get Swarna soothsayer, patients with acidity, 4 to 5 years they're suffering from acidity, and any medicines we are giving, there is no much result. Then we go for soothsayer rasa with gold, wherein we get better results. Or what you can say is chronic and difficult to cure cases, we are using gold as one of the ingredient to fasten or to get better results. And also, as I told yesterday, we are using it in Swarna Prashna. Gold alone is the ingredient there. We are using it for Swarna Prashna in children. Gold is said to be immunomodulator.
Okay. Thank you.
Welcome.
Talking about acidity, I have a small doubt. Actually, in case acidity, is it advisable to take lemon shot in the morning without adding water? Can we take lemon shot in the morning? Lemon shot, that extract of the lemon without adding any water, to be taken empty stomach in the morning. That was advised by a naturopath actually. How it is advisable in Ayurveda?
There is an acidity is nothing but this thing, what you call acid reflux. So here they have advised you the lemon juice along with salt. We usually give Madi.
Nothing, no salt also. Just extract acids you take in the early morning after morning this one.
Okay.
Is it
So
advisable
here
in Ayurveda?
see, as per if we talk in Ayurveda, we are having a medicine called as Madhipala Rasayana. There we are not using exactly the lime, but one of the fruits which belong to the lime family we are using. And that is also giving us good results. Okay. Any more questions? Okay, shall we wind off the session?
Yes, it was a very nice session. Thank you.
Yeah, thank you.
It was a really nice session, Doc. It's just that I need to get used to the different types of words like Sharad and Varsha and Rutu. It's we haven't heard these words before, so it's just going to take some time to get used and familiarize myself with this.
Yeah.
But yeah,
Meanwhile, you can understand the correlation between English, autumn, spring, winter, and then apply the concept.
yes, okay. Thank you.
Yeah.
Thank you so much. It was very
Yeah.
nice.
Okay, I'll end the session.